Recently, the West Loop campus hosted an event to help busy women take better care of themselves.
We're hosting the MammoSafe Coach, which is the only mobile breast imaging coach in the U.S. So we're really excited to have it at the West Loop campus to do mammogram screenings for our students, for our community. Houston Community College has community in the middle of its name, so that really hits at the heart of what we're about. We're right in the community and connected to them, so we like to do events like having the MammoSafe Coach out here to really feel connected and give back something to the community that we serve.
Founder of MammoSafe, Dr. Daniel Rubine, describes the mission of the mobile unit.
Women who are students, women who are faculty, staff, support staff, they often don't have the time because of job, family, and everything else to go get a mammogram. And they seem to be the last ones that are taken care of. So we designed a method for them to take only 15 or 20 minutes out of their day, not take a full day off or a half day off to go get a mammogram, and have it done in a very comfortable, private, and reliable setting.
Rubine explains the importance of a mammogram and dispels some misconceptions.
So it's an x-ray of the breast, and basically it's done usually with 4 views, 2 views of each breast at different angles, and then it's given to someone like me who's a radiologist who specializes in breast imaging to interpret. And the mammogram can be interpreted as normal, in which case if the woman's over 40, just come back in a year. Or it could be interpreted as needing additional imaging, what we call a category 0. It just means we're not quite sure of what we're looking at there. We might need some more pictures. It absolutely does not mean that the woman has cancer. Most of the women who come back for the additional pictures, in fact, don't have cancer, and the finding can be explained some other way. It's very normal, I think, to be apprehensive, whether it's the first one or the 10th one. It's an uncomfortable exam, to be honest. Women that have had it will tell you that, but it should not be a painful exam, and I think that's a very important distinction. A qualified and experienced technologist like the ones that we use understand that the compression that's used to make a good picture goes to a certain point, after which it does not improve the quality of the picture, it only hurts the patient. So once the tech knows, and that's not something that I do, it's a female technologist that does the exam. On the MammoSafe Coach, it's behind 2 separate closed doors and only with the female technologist at the time the exam is being done. So when I designed this coach, which is one of a kind, there's not another one like it in the nation, I paid very close attention to privacy. I'm able to find cancers that are 3 or 4 millimeters in size. I mean, we're talking about the end of a pencil. And at that stage, if it's a stage 1 cancer, it's possible that there could be a 95% cure rate. Now, the oncologists don't throw the word cure around loosely, and not everyone's going to get that, and I don't mean to minimize it. Stage 1 cancer is a serious diagnosis. There's a lot for the woman to go through, but it's very reasonable to be hopeful. And even in stage 4, it's very reasonable to be hopeful, because half of women who are diagnosed in stage 4 are still alive in 5 years. Annually, starting at age 40, no matter what you might have read in the paper, because that is not based on the medical data. The medical data for the last 4 decades supports mammogram once a year, starting at age 40. Second thing is a self-breast exam. Patients should do, we usually recommend 2 weeks before the menstrual cycle for women who are premenopausal, to do a self-exam, and it's something you can look at it on the internet. It'll be downloaded in just drawing form, nothing that would be considered offensive, but it shows how to do it, and it's a very simple process. It should only take about 5 minutes or so, if that long, and most women just do it, when they're bathing in the shower or something like that. So I cannot tell you how many times women have come in and they said, "There's something different here," and that was a breast cancer, and they're the ones that found it, and so we can treat it at that point as we need to. And then the third thing is a clinical breast exam, which means going to a healthcare professional once a year and letting them do a breast exam.
For more information about MammoSafe mobile mammography and resources to learn more about cancer detection, visit www.mammosafe.com. For more information about health and wellness events at Houston Community College, visit www.hccs.edu. For HCC Beat, I'm Stacee Hawkins.